Did you know that every 3 seconds someone around the world is diagnosed with dementia? According to the World Health Organization, nearly 55 million people are currently living with this condition, and it has now become the seventh leading cause of death globally. But here's what many doctors are not discussing openly. In countless cases, the true culprit behind memory loss is not just age or genetics. It could be your medicine cabinet. Hello, and welcome to Healthy Life Keys, your trusted source for aging smarter, living stronger, and staying independent longer. As a physician with over 30 years of experience in aging and brain health, I've witnessed a troubling trend. Medications prescribed for common problems like sleep, pain, indigestion, or anxiety can quietly harm cognitive function. The changes come slowly, subtle forgetfulness, occasional brain fog, and they're often dismissed as just getting older. But in reality, they may signal a medication-related decline. In this video, we'll explore 9 widely used medications that have been linked to memory issues and faster cognitive aging, backed by scientific research and published studies. If you're over 60 or care for someone who is, this might be the most important health information you hear today. Let's begin with one of the most unsuspected troublemakers, the common allergy pill. 9. First-generation antihistamines, a silent threat to senior memory. Did you know that using certain common allergy pills for just 3 years could raise your risk of dementia by over 50%? That's the finding from a major 2015 study published in JAMA Internal Medicine, which followed more than 3,400 older adults. The researchers found that regular use of strong anticholinergic drugs like diphenhydramine, Benadryl, chlorpheniramine, or hydroxyzine was associated with a 54% higher risk of developing dementia. These medications block acetylcholine, a key brain chemical that helps you concentrate, learn, and remember. Unfortunately, these drugs are everywhere, used in sleep aids, allergy remedies, and cold medications. Many seniors take them daily without realizing the long-term effects. You might notice small things at first, forgetting names, misplacing items, or feeling foggy in the morning. But over time, these symptoms may worsen. Advice: review all your over-the-counter medications. Look for diphenhydramine or anything labeled PM. Then, speak to your pharmacist about safer options that won't impair brain health. Have you or someone close to you taken allergy or sleep aids regularly? Did you notice any memory changes? Let's continue with another popular drug, this one for anxiety and insomnia, that could quietly speed up cognitive decline. 8. Benzodiazepines, a quiet risk to the aging brain. What if the pill helping you sleep or calm anxiety today is slowly clouding your memory? Benzodiazepines, medications like Valium, diazepam, Ativan, lorazepam, and Xanax, alprazolam, are commonly prescribed to seniors for insomnia, anxiety, or muscle tension. They increase GABA, a brain chemical that slows nerve signals, promoting relaxation. But studies show this sedation may come at a high cost. A major 2014 study in the BMJ found that people over 65 who took benzodiazepines for more than 3 months faced a 51% higher risk of developing Alzheimer's disease. Long-term use affects areas of the brain tied to memory, attention, and reasoning. Worse, older bodies process these drugs more slowly, causing them to build up and worsen cognitive decline over time. Additional research from Harvard and the Mayo Clinic confirms that long-term benzo users report daytime confusion, balance problems, and delayed word recall. Fortunately, these effects often improve once the medication is tapered off. Advice: benzodiazepines are best for short-term or emergency use. For long-term care, ask your doctor about CBT for insomnia, SSRIs for anxiety, or low-dose melatonin. Have you or a loved one ever experienced memory fog while on these medications? Up next, we'll discuss a popular acid reflux drug with similar risks. 7. Proton pump inhibitors. Could your heartburn pill be clouding your memory? You take it for heartburn, ulcers, or acid reflux, but could that little pill be quietly affecting your brain? Proton pump inhibitors like omeprazole, Prilosec, pantoprazole, Protonix, and esomeprazole, Nexium, are among the most common medications for people over 60. They work by reducing stomach acid, but long-term use has been linked to serious memory problems. In a 2016 study published in JAMA Neurology, researchers followed more than 73,000 older adults. Those who regularly used PPIs had a 44% higher risk of dementia. The reason? These drugs reduce the absorption of vitamin B12 and magnesium, two nutrients your brain needs to stay sharp. Low B12 can cause confusion, trouble walking, and memory loss. Magnesium deficiency is anxiety, poor sleep, and mental fog. Together, they create a perfect storm for cognitive decline. If you've been on PPIs for more than 12 weeks, ask your doctor if you still need them. You might switch to a gentler treatment or use natural approaches like diet changes. Have you ever felt more forgetful or foggy after meals? It might not be the food, it could be your medication. Next, we'll explore a class of drugs designed for behavior, but may actually rob your memory. 6. Antipsychotics, meant to calm, but may quiet your mind too much. Did you know that some medications used to treat memory-related agitation might actually make memory worse? Drugs like risperidone, Risperdal, olanzapine, Zyprexa, and quetiapine, Seroquel, are often prescribed to manage agitation in seniors with dementia or other psychiatric conditions like schizophrenia or bipolar disorder. They're known as antipsychotics, and they work by altering brain chemicals like dopamine and serotonin. While this can reduce behavioral outbursts or emotional swings, it also slows down the very brain circuits responsible for thinking, memory, and motivation. That means fewer mood swings, but also a potential drop in independence, attention, and clarity. In fact, a 2020 study published in the American Journal of Geriatric Psychiatry found that patients taking these medications experienced 2.3 times faster cognitive decline over 12 months compared to those who didn't. The FDA has even issued black box warnings, stating that seniors with dementia who take these medications face a higher risk of death. If someone you love has been prescribed an antipsychotic, talk to their doctor about alternatives like behavioral therapies or non-drug interventions. Now, speaking of sleep and behavior, let's take a closer look at a popular class of medications often seen as safe, but possibly harming your brain overnight. 5. Z-drugs. Are you sleeping through a silent memory decline? What if the pill that helps you fall asleep is also quietly interfering with your brain's ability to restore itself? Z-drugs, like zolpidem, Ambien, isoprene, Lunesta, and Zaleplon, Sonata, are widely prescribed to older adults who struggle with insomnia. These medications are designed to mimic the effects of natural sleep. But here's the catch: they don't replicate the full sleep cycle. Studies have shown that Z-drugs disrupt REM and deep sleep, the two stages most responsible for memory consolidation and brain detoxification. Without them, the brain cannot properly file memories or clear out cellular waste, both essential for long-term brain health. A 2018 British Medical Journal review found that seniors using Z drugs had a markedly higher risk of confusion, falls, and dementia. And alarmingly, these effects sometimes persist even after discontinuing the drug. If you find yourself groggy, forgetful, or unsteady in the mornings, it may not just be poor sleep. It might be chemically altered sleep. Start with lifestyle adjustments first, such as dimming lights at night, avoiding screens, and reducing caffeine. Under a doctor's guidance, low-dose melatonin may offer safer support. Next, let's take a look at a class of antidepressants still common in seniors, but with side effects few talk about. 4. Tricyclic antidepressants. Could your antidepressant be clouding your mind? Have you been taking an older antidepressant for years, maybe for mood, pain, or sleep, and noticed your memory is not what it used to be? Tricyclic antidepressants, TCAs like amitriptyline, doxepin, and nortriptyline, were once the gold standard for depression. Today, they're often prescribed for nerve pain, migraines, and even insomnia. But here's the hidden danger. They belong to a class of medications with strong anticholinergic effects, meaning they block acetylcholine, the key neurotransmitter for memory, learning, and focus. A 2015 JAMA Internal Medicine study followed over 3,400 seniors for a decade. The results? Those with high cumulative exposure to anticholinergic medications had a 35% increased risk of developing dementia. The effect was dose-dependent. The more you took and the longer you used it, the higher the risk. These drugs may also slow reaction time, increase confusion, and intensify brain fog, especially when combined with other anticholinergic medications. If you're on a TCA, ask your doctor about safer alternatives. SSRIs like sertraline or citalopram, or non-drug therapies, may be better for long-term brain health. Let's now turn to one of the most unexpected medications affecting memory. 1 millions take to manage bladder issues. 3. Bladder Antispasmodics, controlling your bladder at the cost of your brain. If you're using a medication to help control frequent bathroom trips, you might be trading urinary relief for memory loss. Bladder control drugs like oxybutynin, ditropan, and tolterodine, Detrol, are among the strongest anticholinergic medications prescribed to seniors. They work by relaxing the bladder muscles, but in doing so, they block acetylcholine, a critical chemical messenger in the brain that supports memory, focus, and learning. A 2017 UCSF brain imaging study found that older adults using bladder antispasmodics had notable reductions in brain volume and connectivity, particularly in regions tied to memory. Even more concerning, a separate neurology journal study linked these medications to significantly worse memory and verbal fluency scores, key predictors of cognitive decline. Many seniors stay on these drugs for years without realizing the long-term impact on brain health. Ask your healthcare provider if you're on one of these medications. Non-drug approaches like pelvic floor therapy, timed voiding, or biofeedback can offer safer relief. And if medication is necessary, newer alternatives with minimal brain penetration may pose less risk. Next, let's talk about a drug millions take daily for heart health, but few know it could be dulling their memory. 2. Statins, protecting your heart, but at what cost to your mind? Statins like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are among the most commonly prescribed medications for people over 60. They're praised for lowering LDL cholesterol and reducing the risk of heart attacks. But for some, the cost may be cognitive clarity. Certain statins can cross the blood-brain barrier, potentially interfering with the cholesterol-dependent production of neurotransmitters like dopamine and serotonin. Your brain needs cholesterol, not just for neurons to communicate, but to maintain structure and memory processing. A 2021 review in Frontiers in Aging Neuroscience noted that statins may contribute to cognitive side effects in individuals especially sensitive to low brain cholesterol levels. Meanwhile, a pharmacotherapy study found that 75% of patients who experienced memory problems while on statins reported improvement after switching medications or stopping them altogether. However, statins also reduce inflammation and lower stroke risk, which can support long-term brain health in some cases. That's why this issue is complex. If you're noticing memory fog, talk with your doctor. A hydrophilic statin, like pravastatin, may offer heart protection with less effect on your brain. Next, we'll uncover the single most overlooked and dangerous threat to your memory, one hiding in plain sight, often in combination. 1. The hidden danger of anticholinergic overload. You may think one pill is harmless, but when they stack up, the result could quietly rob you of your memory. Anticholinergic drugs block acetylcholine, a vital brain chemical responsible for learning, focus, and short-term memory. While one medication may cause minimal disruption, taking several anticholinergic drugs, even at low doses, creates a compounding effect that researchers call the cumulative anticholinergic burden. These drugs show up in unexpected places: sleep aids like diphenhydramine, bladder medications, cold remedies, GI treatments like scopolamine, and even some antidepressants. Many seniors unknowingly take multiple anticholinergic medications every day. The landmark Adult Changes in Thought study tracked over 3,400 seniors for more than 10 years. It found that individuals with high cumulative anticholinergic exposure had a 54% higher risk of developing dementia, even if they had stopped the medications years earlier. Bring your medication list to your next doctor's appointment. Ask specifically about your anticholinergic load. A medication review can often uncover overlapping drugs and offer safer alternatives that protect both your body and your brain. Up next, let's quickly recap everything we've covered, because knowledge, not fear, is your best defense. And there you have it, 9 common medications that could be silently affecting your memory, especially after the age of 60. From over-the-counter allergy pills to sleep aids, bladder medications, and even statins, each of these drugs has been linked in scientific studies to increased risk of cognitive decline. And while every situation is unique, the key takeaway is this: your medications matter. What may seem helpful for one issue could be quietly harming another, particularly your brain. Now is the time to take a closer look. Review your medications with your doctor or pharmacist. Ask about safer alternatives. And most importantly, trust your instincts. If you or a loved one has been feeling more forgetful, foggy, or off lately, don't just chalk it up to aging. Thank you so much for watching Healthy Life Keys, where we're committed to helping you age smarter, live stronger, and stay independent longer. If you found this video helpful, please give it a like, share it with someone you care about, and be sure to subscribe for more senior-focused health tips every week. Stay sharp, stay safe, and we'll see you in the next video.